So this is the landing page that you will receive when you click on the menu of IPD Doctor Desk. You can see here IPD Doctor Desk Lite. So here you will see just like OPD Doctor Desk, you will have a department unit here and then wards here. So the combination of these things will fetch you the details of all the list of patients who have been admitted. So this is a default page that we are seeing here. Going to the next slide. Here you can see first you select the department and unit here, or you have an option. Sometimes wards are not defined by one particular department or unit. So there may be combination of departments that can be there in a single ward. So what you can do, you can select all department also as an option, and then you will select the ward. So a combination of that will give you a list of all the patients admitted here. So this is the list of patients that you can see, and you will also see the summary of the patients admitted as per the selection you have made for the department unit and the ward. You will see in the left side the summary of it. So for the selected unit of cardiology in all the wards, so there are like 46 patients have been admitted. Out of them, 12 patients for whom discharge notes have been already prepared. So this is the summary you can see. And after that, you will have the complete list of patients here. So most of you must be already using the OPD Doctor Desk. So where you can see the list of patients in this manner, and you have an RX button here. Say if you are going to one particular patient in a particular ward and bed, and that patient name can be searched here. Search bar can be used for searching the patient by name, Umeed number, admission number or CR number. So whichever identity is appropriate there, so you can search accordingly. And after that, you have to click on the RX button. So after that, it will take you to the next page where the patient case will open, case sheet will open, and then rest of the details can be updated there. So on the list page, you will be able to see the patient name, CR number, admission date, the age, gender related aspects, the patient category, ward and room details. So all these details will be available here. So now coming to an individual case, after clicking on the RX button, it will open the patient case. And this case is also more or less similar to the OPD Doctor Desk Lite. So here, when the patient case is open, on the top, you will see some of the summary of the patient, like a patient name, gender, age, and a CR number. These will be available. And if doctor wants to see the image of the patient, suppose somebody trying to impersonate another person and you want to cross check, in that case, you can click on the view image button here. If you click on it, patient image that is coming from Umeed, UMID, so that will appear here. So you can cross check whether that patient is bona fide or not. However, mostly we do not require, because all the necessary scrutiny normally happens at the time of admission or at the registration page itself. And here the patient other information, also relevant information you can see. So here you have admission number, admitted date, department, unit, ward, room number, bed, and consultant name. So all these details will be available here. After that, you will have these other details that you can fill. So it is a continuous scrolling page. So in one single interface, you will be able to go to a respective slot where you want to fill other details. So now let us go with one by one all the details that we can see in the new IPD Doctor Desk. So now there are some more information that are available for the patient. If doctor wants to see more details about the patient, then there is a patient summary icon here. So if you click on it, then it will give you a complete picture of the patient. His demographic details, official information, the medication, current medication details, all the recent investigations that have happened. So all these details also will be appearing here. Apart from that, you will also have the patient list here. Suppose you have gone to one patient and you have opened a case here, but suddenly you want to move to another patient, then directly from the patient list itself, you can go to other patients also. So it will have two different headings here: discharge prepared patients list and then admitted patients list here. So here the doctor will have some more comprehensive information of the patient. So the past RX button is there here. So if you click on a past RX, it will show you the details of OPD as well as IPD related RX pages. So if doctor wants to check the OPD related past prescriptions, then those things can be checked here. Then if IPD related only prescriptions have to be checked, then this button can be used here. So these two buttons you can use, and whatever selection you do, it will show all the date-wise, time-wise episodes that are available here. And if you click on it, then it will show the complete details that are available for that patient. So this is to view the past history of the patient with reference to only prescriptions. However, we will also have the option of viewing the complete medical record, which comes under EMR, electronic medical record. That button also will be there. We will see that. So this is a EMR related tab that is available here. So if you click, see the past RX, adjacent to that, there is a EMR tab also. So if you click on it, then again it will also show the electronic medical record bifurcated into OPD and IPD. So after you selecting the OPD or IPD, then it will show all the details of medical history in terms of the themes that are available here. If you want to see the history of the profile, history of vitals, history of the medical history, examinations, allergies, chronic illnesses, complaints, so all those details also can be seen here. And when you click on the EMR page, it will give you this interface where you will be able to select some of them, and it will give you a complete graphical interface for that patient, which will make it more convenient for the doctors to take a holistic understanding of the case. And to capture the vitals, you have the button here. You can capture the vitals, and here you can see the complete history, examination, chronic illness related templates will open from here. So this is the same interface that you had in OPD Doctor Desk. So these are general templates for the history, examination, and chronic illness. Apart from that, for each department and unit, you may have a different templates for the IPD. So those things will be available here. These are bifurcated into CT, which means complaints related template. Then ET is examination related templates, and HT is history related templates. So all these templates we can make with reference to a particular department. Like cardiology will have a separate set of examination or complaints related template. So those things we have already configured. So we have got all these inputs, and we have already done with the previous version. So in the new version also the same thing is available. And here the diagnosis related tab will be there, and this is a procedure related tab. So if any patient who is admitted requires any procedure to be done, then they can select the procedure area, the service area, and then the procedure can be selected from the drop down option, and then they can add it. So that request will appear in the respective service area, and they will further administer it. And if doctor wants to see the history of procedures that have been administered, then doctor can check with this administration tab. And if they click on it, then it will show all those history of procedures that have been done for that patient. And this is the drugs related tab. And you can see same like the OPD Doctor Desk. You have an option to enter the drugs here, and you can also indicate the dosage, frequency, and the starting date, and how many days it has to be administered, and the quantity automatically it will come. And then you will also have the special instructions here, because the patient is admitted here and this information has to be followed up by the nurse. So you can always indicate the special instructions here. If a patient requires a particular brand, that information also we can indicate here. So that we will see in the next module that we are going to present, how local purchase module will take care of the requirements for the brands. All that we will see. So after entering all these drugs, so you can add, you have to click on the add button. Then the drugs will appear in the list here. So here in the sample case, we have the 3 drugs that have been added here. And you can see some of the options available here for the revoking option. This is an important feature. We'll just explain you how it has to be used. So sometimes doctor prescribed a particular drug, but however, this drug is not required, say, after 1 day. The patient condition either improved or deteriorated, so he needs a different medication. So the old medication that is already available, so that can be revoked by the doctor. So once it is revoked by clicking on this option, then the doctor has to indicate the revoking remarks, and it will not be available for the nursing desk to administer again. So this is an interface we have newly developed for revoking the medicines. And this is a tab related to the allergies here. And you can also see the consumables and new drugs option also available here. So in the consumables thing, you can indicate if any consumables have to be issued to the patient. So that can be entered here. And this will be available for the pharmacist or the stores in charge to issue to the patient. These are post-operation related details. So if a patient has been admitted and undergone the surgery, so then the post-operation related details can be updated here. You can see the operation date, operation details, and the surgery information. All these things can be updated here, and the operative findings also can be updated here. Then the PAC requisition, if a patient who is admitted requires a surgery, then it has to be preceded with a PAC. So the PAC request, so that pre anesthetic checkup related request can be raised directly from here. So the date of request, the suggested anesthesia that is suggested, that also will come. Then what is the surgery that is proposed or recommended, that also will come here. Then the operation type, all these details will come. So you can directly raise the request for pre-anesthesia checkup from this IPD doctor desk itself. We have also included the referral related tab in the IPD doctor desk itself, because earlier the referral was not connected from the IPD. It was suggested that the offline related process can be used for that. So now we have integrated this referral thing in the IPD doctor desk itself. So if a doctor finds that a patient needs a referral to private empanel hospital, they can select the private empanel hospital here, and they will select the department, institute, and the reasons for the referral, for how many days the referral is recommended, and the clinical notes that justifies the any examination, investigations, or the treatment. Those things can be updated here. After that, they have to click on the add button. Then the request for the referral automatically gets reflected in the referral desk. So the referral module that we are going to present next, so we will explain how this request coming from either IPD or OPD, how that will happen in the further stages. So in IPD, the admitted patients require a continuous updation of their details. So here under hospital course related tab, they have the options of entering the course or stay notes, or the instructions or treatment notes. They can enter here, doctors, which will be available for the nurses to administer. And if doctors wants to check what nurses have been administering and what nurses have noted, nurses also will be noting some observations. Those notes also can be checked here. So if you click on the nursing notes, you will be able to see the other details. And doctor wants to record some of the notes here. Those notes can be entered here, which will be instructions available for the nurses to see. So these are the treatment related instructions. And if doctor wants to see the previous doctors who have visited this patient, if they want to see the past notes that have been recorded, so they can click on the show past notes. So it will show the course related notes or treatment related notes also in this thing. So here, as I said, if you click on the nursing notes related tab, it will show what nurses have recorded for this patient. That notes all can be checked by the doctor in this desk. And if the doctor is clicking on the show past course related notes, so that will also come in the date and timestamp related thing, and it will show all the details here. Similarly, for the instructions or treatment related guidelines, so those also will be available here. So in fact, I mean, these are all coming from the, will be part of the past RX. So if somebody wants to see the past RX tab that we have initially seen, so all these details also will be available there. So if somebody wants to see only specific information, then these tabs can be seen. Otherwise, this information will be available in the prescription also. And after that, then finally, after recording whichever tabs are relevant for that patient at that particular time, then the doctors can save this prescription. So after saving this, whatever information has been filled, that all will condense into a one single prescription. It will be part of the EMR also, and it will also become a one prescription. So this information, whether the drugs have been prescribed, whether the investigation has been raised, whether the procedures have been advised, or the referral has been advised, or the course related, treatment course related information that has been filled. So all these details will be flowing into a next subsequent stages. Investigation will appear in the sample collection area or the nursing desk. Drugs that have been advised will be reflected in the pharmacy desk for the direct issue to patient, where the nurses can go and collect the drugs for the patients, and they can start administering the drugs. So all that, every process is interlinked to the subsequent stage. Similarly, for referral also, whatever referral that has been advised, that will go to the referral desk, and the approving authority will approve it, and then the referral letter can be issued, and after that patient can be discharged here.